ji, I fully agree with Jabbar, and just a passing mention of what you and Jabbar alluded to before I take your question.
Yeah.
That in pregnancy, often we feed for 2 people.
True.
The child is not even 2 kilograms, and the mother. So remember, you cannot be feeding for 2 people. That is deleterious, because in the first month, the mother is vomiting. The second month, we are feeling double, and that actually leads to weight gain, and that leads to diabetes in the mother and later on for child for the future. That's number one. Number two is that you asked the question that when you have people living with obesity and diabetes, they get type of complications. All types of complications they get. They can get depression, they can get anxiety, psychiatric complications. They can get medical complications, which means that they can get complications like heart disease, heart attacks, hypertension, brain stroke, retinopathy, premature cataracts they get. So their cataracts come early. I had just a person living with diabetes with obesity at age 32 could not see from both the eyes due to cataract.
Oh God, that's literally kind of unheard of.
They get neuropathy.
Yeah.
They get kidney damage, and sometimes they have to land up unfortunately with dialysis. So those are the vascular complications. And if they don't take care of their feet, then they get the wounds don't heal fast, which all of us know.
Yeah.
And then if the ulcer develops and the ulcer doesn't heal, then sometimes we have to do foot amputation. Taking care of their feet and maintaining good hygiene is very important. They are also more susceptible for infection. Their immunity level is low. So whether it is skin infections or fungal infections, they are very common. Mainly genital skin infections and fungal infections are common. And then also systemic infections like TB. 10% of people with diabetes are susceptible to TB, and 10% of people with TB are susceptible to diabetes. So there's a figure of 10. So infections and immunity is lower. And finally, mechanical complications. For example, because of excess weight, they get asthma, and they are not able to breathe. They get out of breath. They get heart failure. They get sometimes severe osteoarthritis. They can't move their knee joints or joints. So all these problems and complications can occur.
Basically, this obesity or whatever, excess adipose tissue, whatever be the terminology, the major reason behind this is fat deposition. Fat deposition, main reason is your physical inactivity or sedentary lifestyle. But mind you, there are other causes also for excess fat deposition. One is overeating. People are taking a lot of calorie, maybe in the form of carbohydrate, maybe in the form of fat, maybe in the form of other forms. Whatever, if you are taking excess calorie, energy for that matter, the excess energy is getting deposited in various tissues. As my friend Dr. Shashank was discussing, that will get deposited in the abdominal area, liver area, pancreas area, in most of the other internal organ also. And apart from eating, there are other contributing factors also. Number one, certain drugs can contribute. Number three, certain genetic syndrome. Simplified language is familial syndrome, something like that. Okay, diseases runs in family. Certain drugs can produce obesity, and very interestingly, sometimes don't take a message that all these problems are due to this genetic problem or drugs or due to your overeating. Basically, by and large, all these problems are due to overeating. Okay, and very rarely you can get intracranial or brain issues also can produce obesity. Like, see if the patient has got a problem in the pituitary or hypothalamus region, these are the areas where your feeding habit is coordinated. So there also you can get obesity. These are the few causes, but I want to make it very clear, mainly it's because of overeating and physical inactivity over for the time being.
there are range of symptoms or indications that the patient or a person might have diabetes. Now I'll just elaborate a few. The commonest ones are usually increase in thirst. That means that you want to continuously, drink water, you feel thirsty, and that leads to frequent urination, and generally, that upsets you when you have to get up at night. So the patients, they have increased thirst, frequent urination, the volume of the urine they pass is very large. There can be associated increased hunger. You feel hungry continuously. But despite of that, there can be an unexplained weight loss. And you keep on losing weight in spite of the fact that you are eating more. Okay. Then other common symptoms are, unexplained fatigue, weakness, slow healing of ulcers or cuts or sores. There could be excessive tingling, numbness on your hands and feet. There could be leg cramps. The vision can get blurry sometimes. You are vulnerable to catch small infections. The severity of the infection is, generally very high. And especially in women, as Dr. Shailaja was talking about, the genital tract infections, vaginal infections are very common. So what you should commonly do is that consult your doctor immediately, because understand that early diagnosis and treatment are very crucial when you are managing diabetes and when you are trying to prevent the complications related to diabetes. Get your blood sugar tested as per the doctor's advice. That is the most primary test which generally is suggested. And then follow your doctor's recommendation, which may include the array of interventions and diet and exercise changes, the medicines, and sometimes even insulin is suggested by your doctor. But remember that early detection of diabetes and management are the key to live healthily with diabetes.
Diabetes is same in men and women, but women are different than men. So there are some differences which you need to deal when a lady gets a diabetes. Yeah. So first, I think the targets, what should be your glucose, what should be A1C, the treatment, everything remains same. But because of the hormonal changes which happens in a woman's life, it makes a hell lot of a difference to the diseases like diabetes, which are metabolic diseases. So there is a major difference if I speak about menopause. So these hormonal changes before and after menopause create more fat deposition, obesity and weight gain, which itself creates more problems for the diseases like diabetes, where the fats and the glucose are very important. So around menopause and post-menopause, all the problems for diabetes may increase. So that is one point. Another, I feel, weight loss, which is the crucial thing in diabetes who are overweight, is very difficult for women. So the whole lifestyle changes or the weight loss strategies are to be taken differently, more emphasis on diet, and exercise is slightly different. One very important aspect in the women, in the elderly women, is sarcopenia. So which is less muscle mass, and less muscle mass is not good for health. So this sarcopenia happens post-menopause, it increases with increasing age, plus diabetes itself induces sarcopenia. So women, particularly for their bone and muscle health, which are the crucial factors in diabetes management, they need to take more. So one simple advice, of course, there are drugs, vitamin D, everything, but exercise in women is different. Only walking is not good. They have to emphasize more on muscle strengthening exercises, stretching exercise, along with calorie burning exercises. So every day's exercise should have these three components, which will take care of at least some good muscle mass, bone strengthening, along with, of course, everything else in diabetes. If you talk about women, there are 2-3 more aspects which I can say now or maybe in next conversation, like young girls and the pregnancy. Only one point about overall women and diabetes I want to emphasize. Usually people say the most common cause of, let's say, is cancer in women, which is not true. It's the cardiovascular diseases. Heart problems are the major issues in women with diabetes. And that is been neglected as other problems are neglected in women. So cardiovascular risk in women needed to be assessed very, very aggressively, carefully by treating physicians as well as the patients. So whatever tests are required for the heart, need to be done, stress test, echo, angiography, thallium. So many tests are to be done aggressively in women to diagnose, because these heart problems are more lethal, more severe in women compared to men.
So, annual checkup is for detection of diabetes. So once you are found diabetic, you need regular follow-up. Initially, you will need, after the treatment is initiated, you will require some quick follow-ups after sometimes 1 month or even 2 months. Subsequently, and there, in that phase, the medications are being titrated. Certain amount of medications were started, and you have done reasonably good diet and exercise program, and it's not working, then it is escalated stepwise. So the titration phase, you need to be seen very frequently. Some of us have started doing that, and many doctors will agree to do that on phone for you, and even on an email communication, they can give you a reply how much to increase, looking at your blood sugar values. So that can be made a bit easier for the patients. Subsequently, they require quarterly follow-up. Quarterly means 4 visits a year to doctor is very, very essential, because many complications are asymptomatic. Diabetes also, to start with, is asymptomatic disease. You don't even know that you got it. And sometimes it's detected 2 years after you have been diabetic. So, and the complications also are silent until they explode in the form of a heart attack or a stroke. So you have to be checked. So this checking is very important. Now, what should be checked? See, initially you do require a lot of workup to see your lipids, and your cholesterol, and any already some vascular problem happening there, whether your eyes are okay to start with, all that. So initially you do undergo a lot of investigations. After that, quarterly is very simple. You take your blood sugar chart to the doctor. That is very important. The whole blood monitoring is important. You take that, and of course you see what is done is a blood sugar and an A1C, the average of 3 months, and that is all the tests you require. I've seen our patients do a lot of tests, some of them offered free, some of them offered with some kind of conditions, and those are really useless tests. As a matter of fact, many of them show very strange findings which will, confuse the patient, and sometimes it leads into unnecessary questioning with the healthcare provider. So I think you avoid those tests. Too much testing doesn't solve your problem. The interpretation of test and an appropriate action by a healthcare professional, a doctor or diabetes educator, is the key to success, and not doing the tests. So please do not overdo the laboratory tests. And once a year, you'll undergo complete checkup. With little advancing age, they will require heart checkup, little detail like a ECG, a 2D echo. So besides all the routine checks that I told you, and of course, eye checkup, you see, it has to be done once a year very carefully. After putting the drops in the eye, it is not with the optometrist. Sometimes patients don't realize the difference between the optometrist, one who just knows how to find good, normal, proper glasses for you, versus a really trained ophthalmologist. And he or she also has to put the drops in the eye and examine dilated eye pupil and see the retina carefully. And of course, we check the nerves very easily at the bedside. Most diabetologists do that by measuring pinprick and all those sensations. So all these checkups are required, but one should not get frightened. Frankly, they are not very large number. In fact, patients tend to do more than what is required, and in that process, they spend a lot of money and time, and then frankly, they do not want to undergo the right thing. So the correct follow-up is simple, and I don't get to get hard. Patients should not worry about this and do it as a matter of routine.
Right.
Diabetes imposes a lot of restrictions on various parts of lifestyle. You need to follow a dietary schedule which includes amount of calories, your fat, the distribution of various calories across the whole day, the amount of carbohydrate, the type of fat you're consuming, the amount of protein you're supposed to consume. So with a liberal food style, we don't care about. We eat what food we want. Because food increases blood glucose levels. There are few foods which don't increase our blood glucose levels, and we recommend those kind of carbohydrates actually. We put a limitation of fat, we put a limitation of salt, we put a limitation of protein also to a certain extent, at least optimal amount of protein has to be. So with this kind of food restrictions on the person, he really feels distressed, number one. Number two, you need to do a regular exercise because it has to be around 120 to 150 minutes per week, spread in a session of at least 20 to 30 minutes. That's extremely important. Avoid smoking. Take alcohol in moderation or better to stop it because liver disease are both common in diabetics. So a lot of changes in lifestyle are required. That's one aspect of the whole story. Second aspect is every time you are bothered about how my blood glucose levels are going to behave if I skip my exercise schedule for 5 or 6 days time. You are a constant fear of complications that, look, I'm going to blind if I don't control my sugars. It should not go haywire. I may contract some urine infection or get a kidney failure at a later date. So these are kind of stress. As Dr. Altmarsh said, depression is pretty common. They have a pretty huge amount of anxiety and concern actually. So all of these things really impose a lot of stress in the person's mind and physique. The point around it is very simple. What we are advising is just maintain a healthy lifestyle. That's what is required. You are not doing a good lifestyle, you are overweight, you are not exercising enough. That's the reason you develop diabetes. We are putting back you on the track actually. Second thing is, no doubt, diabetics people have got high rates of complications. But fortunately, all are preventable and can be detected in an early stage. So counseling is important at the start when that person has been detected to have diabetes. One needs to tell, see, look, this is not the end of the life. You have to just maintain healthy lifestyle. Avoid certain things in the life, like alcohol and smoking, when in any case we advise to any only person. And screen for complications at an early stage, as Dr. Chaz said. At least once in a year, you should screen for all these complications or basic tests. They're not very expensive. They can be done at any clinic or primary healthcare center. You need to go to a top and super specialty center for this. So by reducing and counseling these things, advising them time and again, we can really reduce this kind of stress to these people. Counseling really helps.
Everything is determined via your eye. If you don't have an eye, you just are blind enough, and if you are blind, then you can't see this beautiful world. When we talk about diabetes, again the same point arises that why sugar will damage my eye. So eye from the external to the internal part. How you can label, suppose a diabetic patient walks in your chamber with high blood sugar, his first complaint might be associated with all the osmotic symptoms would be blurring of vision. And for that, he goes to whom? An ophthalmologist. He checks the number and gives a number. That is a wrong thing. If your blood sugar is high, that causes some changes in your lens so that your vision blurs. So this is an early presentation of diabetes. First, correct your glycemic level. Once your glycemic level is controlled, your vision may spontaneously improve, one, or if it doesn't, then you need an ophthalmological care. So this is one point how the diabetes may present, first with blurring of vision. When we talk from outside to inside, what Sushil sir was also telling, once in a year, a detailed eye examination, which includes your examination of a lens, which includes your examination of overall structures of eye and retina per se. What a patient will do, suppose we tell a patient that get your eye examination, he will just go to an optometrist, rather not an ophthalmologist also, and will get a check of his number. So that is not a detailed examination of diabetes. The detailed examination of diabetes, because diabetes per se is an early cause of cataract. In a younger population at the age of 28, 30, we see good amount of cataract surgeries being done in a diabetic patient who is not controlled. So one, then there are certain changes like corneal damages, scleritis, iritis. So these autoimmune disorders are exhibited by uncontrolled glycemic values if you have some of these disorders in your eye. Associated with it, retina. this is the biggest problem. If you don't detect it on time, because there are good amount of stages of diabetes, from non-proliferative to proliferative diabetic retinopathy, where a patient may bleed spontaneously in his eye, the vision may be gone. So there are certain reversible changes, there are certain irreversible changes. So if you detect it early, an ophthalmologist has a power to do a retinal surgery, oblique an injection in the retinal space, or that is what is intravitreal injection all about, or a laser therapy. So these early interventions may help you from retinopathy and from your vision loss. But if these are taken extreme level, I don't think any ophthalmologist may be of a help. So the only point telling all these things is that you can prevent your vision loss via glycemic control, one, via regular examination of your eyes, and taking care of your basic needs, what every system in diabetes should do. So these are the basic things you can take care of your eye in a beautiful manner.
The neuropathy complication, which actually brings the patient to the doctor, there could be either a positive symptom or a negative. What I mean by that is, for example, there could be a tingling sensation, there could be a burning sensation in the feet, there could be excruciating pain in both the feet, there could be an extreme higher or more sensation even for the touch, or there could be the opposite thing like numbness over the feet. Generally people say my feet are sleeping, I do not understand. Or they may come with a foreign body sensation, or some foreign body, like for example a small pellet or a stone or a stapler pin or something like that in the feet. So they might look at it later into what has happened. And nearly around half of the people in diabetes do have neuropathy. So I think that's a very important thing that we are talking about loss of sensation, loss of protective sensation. And this is again preventable, this is again controllable, absolutely. And what is really important is, just by controlling the diabetes, there are various studies and data on that, by controlling the diabetes, you can reduce the risk of neuropathy by around at least 15-60%. And there is a published data in that. I think one line message I would like to give is that feel your feet and don't let diabetes steal your step.
Adherence is one of the very important cornerstones of any medication or any medical treatment, especially the chronic ones like diabetes and hypertension. And if we go with the data that are our patient adherent, I've been witnessing a study in the last week regarding that of the meta-analysis. Meta-analysis is a compilation of many studies. So they have taken the data of 27 studies across all over the world, and they found that adherence was only to the tune of about 30 to 60%. That means our up to 70% patients, they are not adherent. And same data showed that if you talk of 80% adherence, that is जितना मैंने medicine बताया, उसमें से 80% जो अगर कोई medicine ले रहा है, number of those people is only 22%. So this shows that adherence is not good. But answer is why it is so. Because whenever we think of anything, उसका कोई ना कोई कारण तो होता है. So we have to see what is the reason for that. The most important reason in country like India has been the cost. Sometimes the medications are expensive. Patient is not able to afford that. Because in India, we usually have the budget for all the things. We have a budget for the doodh wala, we have the budget for the ration wala, we have the budget for the home, we have the budget for the bike, but there's no budget for the medicines. Therefore, this thing has to change, that we should think that health is also important and we should have some budget for the medication also. And second is that sometimes the number of medicines is quite high. That is, patient has to take 5, 6 or 7 tablets, because patient of diabetes may be having other disorders also. He may be having high blood pressure, he may be having some heart ailment also, he may have some joint problem also. So there are number of medications, and because of such high number of pills, he has tendency to skip couple of them. Third thing, if we see, it is regarding the forgetfulness, especially in our senior citizens. They tend to forget the medicine. Le liya hai, nahi le liya hai, they tend to forget it. So this is another reason. Then sometimes it is the education status. So patient is not that well educated to understand what is the benefit he is going to achieve with that medicine. So that's another factor. Then sometimes it's the lifestyle. So patient lifestyle is so busy. He is traveling here and there. He has got to attend a meeting over there. So he has tendency to forget the medicine. And last but not the least, which is very important, is the fear of the side effects. So patient may think that every medicine which I am going to take is going to give me the problems. So that fear of side effects is one thing which is going to cause the lack of adherence. But what I tell my patients is, none of the medicines which are being prescribed for diabetes, they have got side effects more severe than disease itself. So diabetes is going to give you more trouble rather than your medication. And the result of this poor adherence is in form of the poor diabetes control, sugar remains high, and there is more tendency to get complications. Complications may be short-term or long-term, and sometimes the cost of managing those complications is much higher than the cost of medicine. So this we have to tell our patients that long-term cost of treatment will be less if you adhere properly to the medication.
Regular physical activity will increase the muscle uptake, will increase the glucose uptake into the muscles. You know that in diabetes, what happens is the blood sugar levels are high in the blood. So when you do more exercise, what happens is the insulin goes and act on the muscles, and the glucose will be taken into the muscles, and muscle utilizes glucose. So normally the blood glucose will come down. So what is the recommendation is, the American Diabetic Association, almost all the bodies recommend 150 minutes of physical activities per week. So you can do 30 minutes 5 days a week, or you can do 60 minutes for alternate days is also possible. So that they recommend in 5 days you do aerobic activities, like you can go for playing soccer, you can go for walk, then you can go for badminton or any other aerobic activities. And the other 2 days a week you can do resistant training. What do you mean by resistant training is like lifting small weights in the gym, or you do some power yoga. These are all resistant training which help you to gain the muscle mass. So once you gain the muscle mass, you will be able to utilize glucose into the muscles. And what happens there have been studies in India which shows that we, as I rightly told, we Indians have low BMI but more visceral adiposity. Even the same thing, we have low muscle mass also. We are sarcopenic. So that will promote us to gain more muscle mass, and the glucose will be utilized in the muscles. So this is what the recommendations are as far as physical activity. And now one more recommendation is limit inactivity. So you break the long bouts of physical inactivity, such as me as a doctor, I start seeing patients, I normally sit. So what I've changed in my practice is I use a standing table, so where I can break my physical inactivity every 30 minutes. So if you are working in an office, after 30 minutes, you just go for a walk around your office or for 5 minutes and come back and sit. So you limit the inactivity by taking small breaks every 30 minutes. Don't do an inactivity for more than 30 minutes. So after 30 minutes, go for a small walk or just stand, do some stretch and come back and sit again.
So many patients have this misconception that is diabetes is just sugar control. So but our main aim is to avoid or prevent end organ damage. Diabetes is a silent killer. So it causes irreversible damage of vital organs like heart, brain, eyes, nerves. So our main aim in treating the diabetes is so that patient would lead a long, healthy life without any complications like developing kidney disease, which may require dialysis, or nerve pain, which may lead to amputation of his legs, or blindness in his eyes due to retinopathy, or cardiac events like sudden heart attack or stroke. So our main aim of treating any diabetic patient is to prevent these complications. The first thing is the patient should be aware of these complications. So all the diabetic patients, they have to be educated that diabetes is not just sugar control. You have to screen for these complications at regular intervals.